Hi, my name is Steve Tressler. I'm a student physical therapist here at Franklin Pierce University.
And I'm also a student here at Franklin Pierce University. My name is Megan Smith.
So what we're going to do is just give you a brief intro on how to perform range of motion. Range of motion is extremely important amongst all individuals, and if your individual is actually able to perform it actively on their own, that's great. We highly encourage that. If they're only able to perform 50% of that motion, you're actually able to go in there and help them with the remaining of that motion. But today, for today's purposes, we're going to be showing passive range of motion.
When you do each range of motion, you want to make sure you're doing it really slow and controlled. Then you're holding each one for about 5 to 10 seconds each and going through the motion about 2 to 3 times to really make sure you're getting as much range as you can. Within the first time you move them, they may not be loosened up enough to get their full range. So it's important to move them through a couple times.
Performing range of motion is very important, especially for amongst individuals that are sedentary or bedbound. This can lead to further complications, secondary complications such as contraction formation, which could really affect someone's day-to-day living. Just kind of, as we go through this video, just be mindful of your own body mechanics for your own safety, as well as always checking in with your loved one to make sure you're not causing any pain. So hi, my name is Steve Tressler. I'm a student physical therapist here at Franklin Pierce University. And today we're going to go through cervical range of motion. With range of motion, it's important that we kind of get the available range, but also not going too far into causing any pain with the individual. So the key things with this range of motion is going to be hand placement, as well as your own body mechanics to make sure that you're safe as well. So we're going to begin with rotation. So we're going to bring our hands, cradle underneath the head lightly. Don't want to cover up the patient's ears. And we're going to have you start with rotation to your right. So bring them to the right side, to the available range. Hang out right here for a little bit. How are you doing?
Good.
Good. We're going to rotate them back to neutral. Cradle the head with the right hand, and then rotate to the left. And always checking with your patient. Feel okay?
Yep.
Great. Next motion we're going to do is cervical flexion. Just going to switch hands. The left hand's going to cradle behind the head, or your right hand, either one you'd like. The remaining free hands are going to go right across the forehead, and we're just going to tilt the chin down to the chest. Hang out here for a little bit. We're going to bring it down to neutral. You're going to leave the left hand cradling, stabilizing the right shoulder with your free hand, and we're going to side bend away. We're going to hang out here for a little bit. Bring back to neutral. We're going to switch our hand placements up, cradle the head with the right, stabilize the left shoulder, and bring them the opposite direction. How are we feeling?
Good.
Hang out here for a little bit. And bring back down neutral. All right, so the first thing we do here is shoulder flexion. Thumb's going to stay up. Stabilize with the right hand here at the shoulder. You want to control just above the elbow. Thumb facing down. Checking in with your patient. How are you feeling?
Good.
Good. Hold out here for a few seconds. Bring it right back down. Next we're going to do is shoulder abduction. You're bringing the arm out to the side, stabilizing at the shoulder. You can use your leg to kind of position the arm. We're going to bring it right up to the ear as far as we can go with that available range. How are we feeling?
Good.
Good. Bring it right back down. We're next going to do internal rotation. Stabilizing the knee with your leg, or the elbow with your leg. Stabilizing the shoulder. We're just going to rotate inwards. Good. Bring it back here. External rotation. Stabilizing that shoulder. Allowing the arm to go into external rotation here. How are we feeling?
Good.
Then you're going to be side lying for extension. Last one for the shoulders could be shoulder extension. We're going to stabilize back of the shoulder. We're going to bring the arm through the available range of motion. Bring it right back down. Good.
Hi, my name is Megan Smith. I'm also a student physical therapist here at Franklin Pierce University. And now we're going to start talking about elbow and wrist range of motion. So first, what we're going to do is you can either stand next to the patient, such as this, on their bed or whatever works for your home setup. But for today, we're going to show it. You can also kind of come underneath here, kind of like Steve did with the shoulder a little bit. So the first thing that we're going to do is we're going to go into flexion and extension for the elbow. So what you can do is stabilize the arm, upper arm here, or you can even just have it stabilized on the bed, because what we're going to end up doing is kind of bringing the arm, just bending it towards itself. And so a lot of times the normal kind of end feel for this is going to be when the skin on the forearm touches the skin up here. So we're going to want to bring it in there and hold for a few seconds. How are you feeling?
Good.
Good. And you might feel a little resistance before that point, and that's okay. Just go into the resistance as long as it's not painful for the patient. Good. I'm going to bring it out. I'm going to bring it all the way back out. And for this one, you do want to be careful that they don't go into any kind of hyperextension. So you do want to stabilize them into that locked out position, but not too far into it. So you want a little bit of bend here, but not like this. Here. Good. And then now what we're going to do is we're going to move into the wrist. So for the wrist, you're going to want one hand kind of stabilizing right at this joint here, and then one hand that's going to kind of move the hand around. So we're going to bend the hand there. Hold that for a few seconds. You still doing okay? Yep. Going to bring it back to neutral and bring it back. Extend it backwards. Good. Bring it back to neutral. Just doing that a couple times and holding for a few seconds each time. Good. Now what we're going to do is we're going to kind of move the hands over towards the thumb and towards the pinky. So first we're going to side bend it over towards the thumb. Bring it back. You still doing okay? Yep. Okay. And side bend it over towards the pinky. You do want to bring it back to neutral each time. Okay, and now what we're going to do is we're going to have one hand kind of stabilizing down just below the elbow here, and then we're just going to kind of turn the wrist here. So it's like you're turning a key lock. That still feel okay? Yep. And the very last one that we're going to do is I'm just going to have you squeeze my finger in here. Bring your thumb in too, please. Thank you. And then extend your hand all the way up. Good.
Hello, my name is Michaela Collar, and I'm a student here at Franklin Pierce University. And today we're going to be going over the range of motion of the hip. All right, so what we're going to be going over next is hip flexion. So what we're going to do is we're going to kind of cradle the foot with one of our arms and then stabilize with our other hand right above the knee. And we're going to bring it up until we feel that little bit of resistance, and then we're going to hold for a couple seconds. Checking in with our patient. How you doing? Good. And we're going to bring it back down. All right, and the next one we're going to go over is hip external rotation. So again, still cradling the foot. We're now going to bring the knee outward and the foot inward till they feel that little bit of stretch. Good. And then hip internal rotation is the opposite. So now we're going to bring the knee inward and the foot outward. And again, holding it for a couple seconds. Good. And then hip abduction is next. So for this one, I'm still cradling the foot, and then my other hand's going to stabilize on the outside of the knee. And then we're going to kind of walk it out until they feel that stretch right along the inside. And we're going to hold it there and bring it back. And the last one we're going to go over is hip extension. So I'm going to have her lay on her side. Right? So with one hand, I'm going to kind of cradle the foot, and my hand's going to be right on the inside of her knee. This hand's going to stabilize the back of the hip, and then I'm going to pull backwards And then they should feel the stretch right along the front of the hip. Good.
Hi, my name is Kyle Contreras, and I'm a student of physical therapy at Franklin Pierce University, and I will be going over knee range of motion. So we are going to work on knee flexion, which is bending the knee, and knee extension, which is straightening the knee. So for knee flexion, just bending the knee, I'm gonna have my stabilizing hand underneath the bottom of her thigh, kind of near her knee crease, and I'm gonna stride. And I'm going to have my moving hand on her lower shin here. I'm just going to try to bend her knee as much as I can, and I'm going to check in with her and make sure she's not in pain, make sure she's feeling okay. You're doing okay? Yep. Then I'm going to come back and straighten a little bit. And I'm going to bend as much as I can, hold it for a few second count, check in on my patient, make sure she's okay, and then bring it down and relax. So that was knee flexion, and then we are going to move on to knee extension next, which is just straightening the knee. And for this one, you're just going to have one hand on the top of the knee and one hand on the bottom of the knee. Just make sure that your hands aren't on her knee cap. And we're just going to gently, straight arms, just gently push down and try to straighten her knee so that it makes a straight line. Not in any pain, right?
Nope.
Okay. And then you let off, push down for a few seconds, try to straighten her leg, and then relax off. And that's the knee. Okay. So the next motion I'm going to show is ankle range of motion, and it's going to be ankle dorsiflexion. So to expose the ankle a little bit, I'm just going to roll her pants up. Her socks can stay there. So I'm going to stabilize right just directly above the ankle joint, and then my moving hand is going to be on the bottom half of her foot, and you're just going to gently push her foot and her toes, try to point towards her face. Hold it. When she gets a nice stretch, you feel a good stretch. Yep. And then bring it down. Hold at the top for a few seconds. So hold it there for 2 or 3 seconds. Make sure it's not in pain, Nope. Good. And bring it back down. That was ankle dorsiflexion. And then the next one's going to be ankle plantar flexion. So it's going to be the same stabilizing hand, and the moving hand is just going to switch from here to here for ankle plantar flexion. I'm just going to point her toes away from her face and down towards the ground. And then bring it back up, relax her, and then bring it back down again. Feels okay? Yep. Good. And then relax her. And then the next ankle range motions I'm going to show is ankle inversion, which is when her foot kind of crosses her midline like that and swivels like a windshield wiper, and ankle eversion, which is going to be when her foot swivels out to the side like that, like a windshield wiper. How I'm going to do that, I'm going to stabilize just above her ankle, or right at her ankle joint if you want to, so right there. And then I'm going to take my hand on the outside of her foot, and I'm going to move her into ankle inversion. Then bring it back and relax her. I'm going to bring it back in ankle inversion. Feels okay? Yep. No pain? And then bring it back. And the last one for ankle range of motion, I'm going to show is ankle eversion. So same stabilizing hand, just moving the moving hand from the outside to the inside, and just swiveling her foot out to the side, as far as it can go without creating any pain or discomfort. Bring it back, relax. Bring it to the side. Bring it back and relax. That's ankle range of motion.